The Da Vinci robot is a new modality that we have allowing us to do advanced laparoscopic surgery, what some people used to refer to as laser surgery, but we no longer use lasers, but it's minimally invasive through small holes where we actually are able to operate in the abdominal cavity. Myself, I do gallbladder surgery and colon resections primarily, but also OBGYNs and urologists are able to do other forms of surgery themselves. But the robot actually refers to the arms that we attach to the ports that we inserted into the body, and then I am able to sit at a console and look through a viewer that affords me the opportunity to operate looking at the insides of the body in a 3D fashion. And the surgery itself is still minimally invasive, but also offers patients sometimes faster surgery, sometimes faster return home, sometimes faster return to work, less pain. I'm actually in the room actually just sitting beside the patient, but for operations that last 1, 2, 3, or 4 hours, you're not actually standing over the patient the whole time. You're sitting at the controls, and the robot arms that go into the patient have various instruments, scissors and graspers, that their only movements are mimicked by my movements at the console. So it can't be like a robot that you might see in a movie that it can all of a sudden start operating on its own, but it will actually have controls for me, and as my hands are moving, the certain controls in the body are mimicking my own movements. It is very precise, and as I said earlier, you're able to see inside the body in a 3D fashion, so the visualization is much improved for the surgeon, and you're able to zoom in very close to whatever you're operating on, which affords you better opportunities for more precise surgery. If you have a gallbladder surgery, you can expect to have 1, 2, or 3 small incisions. If you stay overnight in the hospital, the majority of people stay 24 hours in the hospital, and then they go home and they recover on their own for another 3 to 7 days at home, slowly but surely getting their strength back, getting their appetite back. But you're walking, out of the hospital the next day, you're eating, you're drinking, and relatively pain-free with this modality of surgery. As far as determining who is a good candidate for surgery, there are a few limitations. If you can undergo laparoscopic surgery, you should be able to undergo the Da Vinci robotic surgery as well. So it's only through discussing with your surgeon whether or not this is going to be a good option for you. But patients that otherwise might have in the past had an incision that would go from their sternum all the way down to their pubic bone can now go home in relatively a few days with 4 small incisions with much less pain and faster time to get back to work.